Dr. Anthony Fauci, the face of America's response to the coronavirus pandemic and the director of the National Institute of Allergy and Infectious Diseases, which ran that study. Dr. Fauci, it's good to see you with some good news to report this morning. You said that Remdesivir is not a knockout. This isn't a miracle drug, but it sounds like it is a breakthrough. Can you explain why?
Well, it's a really important proof of concept because this is the first very highly powered, about 1,100 individuals, and it was a placebo-controlled, randomized trial, which I've been talking about for some time now, which is really the gold standard of how you prove something is safe and either works or doesn't work. And although the results were clearly positive from a statistically significant standpoint, they were modest. The improvement was 31% better chance of recovering and getting out of the hospital. That's important, but it's the first step in what we project will be better and better drugs coming along, either alone or in combination, drugs of this type and drugs addressing other targets of the virus. So it's good news, but I was very serious when I said this is not the total answer by any means, but it's a very important first step.
The FDA is expected to grant emergency usage for this so that it could be put into practice right away. What do you know about that? How soon do you expect that?
Well, it's going to be really quickly. I was speaking with the commissioner of the FDA yesterday evening, last night, and he's moving along very quickly. They have not made a final decision yet. They have not announced it, but I would project that we're going to be seeing that reasonably soon.
The company that makes the drug has described a very complex process. This is not easy. It's not a pill. It's intravenous. It takes months and months to manufacture. Are you confident that enough can be out there soon enough to make a difference here?
Well, what I'm hearing, Savannah, is that the company is really committed to get it out as much as they can, as quickly as they can. So I would hope that that actually winds up being the case. I'm pretty confident that that will be the case because I believe they're committed to trying to get this out as quickly as possible. So we'll see, but I think it's going to happen.
We've been talking about a treatment. The big picture here, we all are badly wanting a vaccine, as you well know. The administration has confirmed that it has a program called Operation Warp Speed. That's what the administration is calling it, with, according to reports, the goal to speed the timeline for a vaccine to develop hundreds of millions of doses to be ready by January. Do you feel that's in the realm of possibility?
Yeah. I do, Savannah. I mean, I'm obviously part of the team that's involved in that. And the question is, you always have to say you want to get a vaccine that is safe and that's effective and that you can scale up rapidly. So what the plan is right now, as I mentioned to you a couple of times on the show, we're in the early phases of a trial, phase 1. When you go into the next phase, we're going to safely and carefully, but as quickly as we possibly can, try and get an answer as to whether it works and is safe. And if so, we're going to start ramping up production with the companies involved. And you do that at risk. In other words, you don't wait until you get an answer before you start manufacturing. You, at risk, proactively start making it, assuming it's going to work. And if it does, then you could scale up and hopefully get to that timeline. So we want to go quickly, but we want to make sure it's safe and it's effective. I think that is doable.
That's a big,
if things fall in the right place. Yeah.
I was going to say, though, that's a big deal because we've heard you say 12 to 18 months. I mean, January, hundreds of millions of doses that could be ready. I mean, that would be huge.
Right. Well, yeah, but Savannah, remember, go back in time. I was saying in January and February that it would be a year to 18 months. So January is a year. So it isn't that much from what I had originally said. But it's aspirational.
Well, time flies,
I mean,
guess.
When I said a year, that was the...
Yes.
Yeah, right.
Yeah. Let me ask you about the stay-at-home orders. The federal guidelines expire today. Many states are taking steps now to open up their states in different ways. How nervous does that make you as the person who's got their eye on this pandemic?
Well, Savannah, I wouldn't say it makes me nervous, but it makes me, again, committed to the things that I have been speaking about now for a considerable period of time, ever since we got into the mitigation phase, the 30-day guidelines of gradually opening up as we get into now opening up America. Remember, that's a phased process. The first phase, we call it gateway. In other words, you've really got to have 14 days of continual diminution in the number of your cases. So if the states and locally follow those guidelines in a gradual way and have the capability of, if you get blips, which we will get blips, Savannah, there's no doubt, when you pull back, there will be cases. And what we need to do is make sure they have in place the capability of identifying, isolating, and contact tracing individuals. If they do that,
and do the states that
I feel cautiously optimistic. I feel cautiously
optimistic. And do the states
optimistic
that are taking those
Savannah,
measures
that will do it.
Yeah. Sorry for the overtalk because we're on our satellite, but just do the states that are taking those steps now, in your mind, have that ability to contact trace and crack down on an outbreak if it starts again?
You know, Savannah, honestly, I can't go state by state with you and say this state is doing this and they have it. The only thing I could do is from 40,000 feet just continue to urge the ones who don't have that capability to really go very slowly. And those that do, go ahead and go by the guidelines. The guidelines are very, very explicit and very clear. There's a lot of leeway because we give the governors the opportunity to be very flexible. But you have to have the core principles of the guidelines. You can't just leap over things and get into a situation where you're really tempting a rebound. That's the thing I get concerned about. I hope they don't do that.
All right. Dr. Fauci, thank you for your time this morning. We really appreciate it. And we should mention that tomorrow morning on Today, we're going to have the first television interview with the CEO of Gilead Sciences. That is the company that makes Remdesivir, and that's tomorrow morning on Today.